We opened the lab in 1983.
As the kids will tell you, anytime as they got older, anytime we got busier, if your last name was Wagner, you were at work.
So we basically grew up there. We have a lot of good memories.
I do remember growing up, catching ladybugs in the parking lot and learning how to shoot rubber bands at the people that were sitting at the grinders grinding orthotics.
And as they were growing, we'd be working at nights and evenings, and we'd bring them down to the office and they'd sit and watch movies while Terry and I were in the back making orthotics.
They all have grown up with a very good work ethic.
Every single patient that I see, I try to, listen as much as I can, take into consideration their lifestyle.
We fabricate the orthotic form, and we're able to help reduce their pain and help improve their daily living.
We get referrals from and orders from orthotists, prosthetists, chiropractors, physical therapists, occupational therapists, pretty much the full range of anybody who sees people with any type of lower extremity problems.
Some of the clients that we do work with, some of the doctors and therapists, have different needs. Some of them see the patients and evaluate the patients themselves and have molded the patient already and send us the molds. In that case, a lot of times they'll have questions like, I saw this patient, I did this evaluation, this is what the patient's having trouble with, this is what I'm thinking about doing, what are your thoughts?
We've seen a lot of changes with podiatrists going into larger clinics and not having the time to spend on orthotics and adjusting, casting.
You meet the patients, you learn about them, and you kind of grow a relationship with them in a 20-minute consultation.
I'm able to see those patients, evaluate what would be most appropriate for them, and mold and fit them.
Monday morning, we'll go to Hennepin, see patients. Monday afternoon, I'm in the lab making orthotics.
We can provide that service a little bit less expensive than the regular doctors going into the big clinics, simply because we don't have the huge overhead that the big clinics do.
You fit them with a pair of orthotics, and then you hear from them like a week later or a couple months later, and they say, I'm able to do this. I'm so happy I'm able to actually get out and be active again and all my pain's gone.